Hi, I'm Dr. James Rippey. Thanks for joining me. For the next 20 minutes, we're going to find out how taking the right steps today can really help you take control of your diabetes. You'll hear from experts and people just like yourself who'll share some experiences. And we'll see some real-life dramatizations of people who were out of control and discover how they got back on the right road. The very first step in taking control is knowing your blood sugar number. 140 is the time to stop and take control. If it's above that before a meal, the American Diabetes Association recommends it's time to take action. Diabetes is not a dead end. It's a diagnosis that should make a person stop, look, listen, and act. You can't act if you don't monitor your blood sugar. Whether you're on pills or insulin, you can't manage if you don't measure. To be at your best, you've got to test. And that doesn't just mean at your doctor's office. You can do it at home or at work. With today's meters, it's easier than ever. Digital numbers make it easier to read. And with today's advanced technology, you hardly feel a thing. You can purchase a meter at your local pharmacy. Ask your doctor how often you should measure and which meter may be best for you. As a cardiologist, I've taken care of hundreds of people at various stages of their diabetes. Unfortunately, sometimes I feel like the farmer who tries to catch the horse by its tail after it's already out of the barn. I see a lot of people with diabetes too often after they have suffered some of the terrible complications of poorly managed diabetes. Heart disease, blindness, kidney failure, and some of the other serious consequences. The really sad part is, it doesn't have to be that way. Diabetes is not the end of anything. In fact, taking control now can be a new beginning for many. Early good control of diabetes can help lower the risk of suffering many of the complications that people with diabetes fear so much. Do you know what actor and country singer Mark Colley, football player Jay Lewinberg, and 16 million other people from all walks of life have in common? They all have diabetes, just like you. So if you have diabetes, you're not alone. You're joined by 8 million Americans who know they have diabetes. You can live a full life if you manage your diabetes rather than letting it manage you. Today there's so much good news about diabetes. Information that you can use to help put you in control, take away your fear, and make you more at ease. It's when your pre-meal blood sugar is consistently greater than 140 that you may be at increased risk for complications. In the short term, you may feel tired and lethargic or depressed. You may feel a constant thirst or experience circulation problems in your limbs. You may lose sleep due to frequent nighttime urination. Self-image may decline. You get grouchy. After a while, you stop doing the things that you love and blame it on your diabetes. I've seen it happen. Right now, I'd like you to meet Anne. Her story is based on an experience that many of my patients with diabetes could have had.